Welcome! So today we're going to be talking about some nursing basics. So you have been assigned a patient with COPD, and your nursing gears start turning. What does this mean for my patient? Well, let's start with some basics. COPD stands for Chronic Obstructive Pulmonary Disease. Simply put, your patient has a condition affecting the respiratory system. Basically, they will have difficulty breathing. Being chronic, we know that this respiratory problem has progressed over a long period of time. So what could have caused this in the first place? In many cases, cigarette smoking. Thus, part of your teaching will have to do with smoking cessation. Some other causes include history of asthma, exposure to chemicals and fumes, long-term exposure to air pollution, and inhaling dust. COPD is a group of progressive lung diseases. The most common lung diseases associated with COPD are chronic bronchitis and emphysema. In chronic bronchitis, inflammation results in the narrowing of the bronchial tubes and mucus buildup. Emphysema causes the air sacs to collapse and thus disrupts airflow into the lungs. So if your patient has COPD, it makes it harder to breathe. Your patient will often exhibit coughing and shortness of breath. As symptoms progress, COPD patients may experience chest tightness, wheezing, secretions in the lungs, lack of energy, and fatigue. So how are you going to treat your patient? Well, first of all, look at your patient. Assess their ABCs. Know what their respiratory rate, heart rate, and blood pressure is. Get the baseline so that if anything changes over the course of the day, you can intervene. Your interventions will focus on comfort, medication, and oxygen therapy. Comfort. Is your patient having difficulty breathing? Have them sit up more. Raise the head of the bed 30 to 45 degrees if it's medically possible. Teach pursed-lipped breathing. You may also want to stage activities to conserve their energy. Medications. Your patient may be prescribed bronchodilators to help relax the muscles in the airways, or glucocorticosteroids to help reduce inflammation and improve the airways. Oxygen therapy. If your patient's blood oxygen levels or SpO2 are low, give them oxygen. It's important to note that not everyone who has COPD will need supplemental oxygen. Oxygen can be administered via nasal prongs or mask. Remember to check the doctor's orders for the parameters for O2 sats for your patient. So now you know the basics of COPD. Remember, your patient will have difficulty breathing, so keep assessing them. Monitor their ABGs, we will get into that on another series, and ensure you teach them about lifestyle changes as needed. So until next time, good luck and nurse on.